To say what it is?
Yes.
You can also describe, it has like a little curve and like, like you're in daily living.
This is an alligator forceps, and you operate this by moving the handle. You will get the foreign object in the peak at the end. Peak. Okay? Laryngeal mirror, I better keep the mirror covered. Laryngeal mirror goes down the throat to look at the larynx. Easy way to stop it from fogging up is to put the mirror on the patient's tongue and wipe it off with a gauze. But this will go down the throat so they can visualize the larynx. Tongue depressor goes on the tongue to depress it, to hold it down. Uterine sound, I had to think. This goes into the cervix to reach to the back of the uterus to find out the length, if there's any abnormalities in there or tumors. And it will find out by this part coming in and out over the tumor. So this is a uterine sound. It has measurements on it. Nasal speculum will open the nares so that the doctor can examine the inside of the nose or remove a foreign object. It will open it quite wide, the nares. This is the nasal speculum. Cervical scraper. This is used when doing a PAP. This point goes into the neck of the cervix and it's twisted around to get secretions on here that go into the container. This is used in a PAP. This is a finger guard. It goes on the finger to protect a damaged area. So it will stop it from bending at this joint. And it will also protect it because it's got the sponge inside. These are also finger guards, but used for a larger finger. This one, the dressing would be underneath on the finger, and then you would tape it around. And what this does is it would protect the whole finger and you can't bend it, period. Same with this one. This is a frog splint. Looks like a frog, upside down. This is to stop or to immobilize the joint. Used for damage or maybe fractures. These are uterine dilators. These go into the neck of the uterus. They're all different size, small, medium, a little larger, and these goes a little larger. And what they do is they put it into the neck and it stays there for a period of time to relax the muscle spasm. And that's all that's on this tray. Stop. You ready?
Ready, Freddie.
It can turn off.
All right. This is suture. Always comes in a container like this. It has written on it suture.
Watch out with the needle. Watch out with the needle.
She's like, wait.
This has a very large needle because this needle is used inside the body.
It looked like a fish hook.
Yeah, not quite a fish hook. But it is a suture that dissolves inside, all right? But it has to be around moist, in the moist tissue. This is a blade. This goes on a blade handle. When it's attached to the blade handle, it makes it become a scalpel, all right? We have two thumb forceps. The thumb forceps with the mouse tooth, single tooth they call it. It is traumatic, it will go through the skin. This one is the same, it's a thumb forceps, but it's plain. There are no teeth on it, okay? This is a ring cutter. When you do this, this part goes underneath the ring, this way, goes down. Turn the handle here twice and it will cut through the ring. The probe for an anal fistula to measure the depth and length of it is what we use. This goes into the crack or the fissure, and it will tell us how deep it is and how long it is. That will tell us whether we need to have surgery on the patient or not. Lister bandage scissors come in various sizes, depends what you are using them for. Lister was the name of the doctor that developed them. This bulge on the end here is so that we don't cut a patient. It will slide down. So every nurse should have one of these. Towel clamps. This is for a gauze that we can pick it up and we can dab, or we can smooth medicine on, whatever we want to do, or we can transfer one sterile instrument to another tray. But these are what we use. This is a sponge forceps. Tenaculum. This is used very traumatic. These two needle-like ends will grasp the neck of the cervix, and then the doctor will pull it down so he can take a biopsy from it. So this is a tenaculum. And that's all that's, gauze. Your 2x2, the smaller ones we use for venipuncture, small wounds. The 4x4 is the most common used, because if we need a smaller one, we can always fold it in 4 and end up with a 2x2. Those are the extent of the instruments that I have on this tray. Goodbye.